to make the leap to go totally private practice and not work for anybody and be totally on my own. I'm not sure I would have done that if it hadn't been for my wife.
Hello, everyone, and welcome to Beauty and the Biz, where we talk about the business and marketing side of plastic surgery. I'm your host, Catherine Maley, author of Your Aesthetic Practice, What Your Patients Are Saying, as well as consultant to plastic surgeons to get them more patients and more profits. Now, today's guest is Dr. Justin Yovino. He's a board-certified plastic surgeon and founder of Ideal Face and Body, and it happens to be a private practice in Beverly Hills, and he's been there the past 12 years. Now, Dr. Yovino is nationally recognized as one of RealSelf's 100 top influencers in cosmetic medicine, and he's known for his mastery of advanced surgical techniques, as well as his artistic eye for natural results. Now, he's published in top peer-reviewed journals, presented at national meetings, and is one of the few surgeons performing facelifts, body contouring, and fat transfer procedures comfortably under local anesthesia. And we have to talk more about that. So in this episode, we'll talk about how Dr. Yovino built his thriving Beverly Hills brand, how he delivers concierge level care while scaling his practice, and his perspective on what it really takes to succeed in today's aesthetic industry. Dr. Yovino, welcome to Beauty and the Biz.
All right, thanks for having me. That was great. Nice intro. Feels good.
So let's just start with why plastic surgery? Why not some other specialty?
I mean, it's a bit of a journey, right? For me, that's funny. Patients ask me, and I get this frequently, oh, you always wanted to be a plastic surgeon, didn't you? Like as I'm talking to them or we're doing surgery, and they just assume that. But the reality is no. Like I went into medicine, so I went to University of Miami Medical School with really an open mind. Honestly, I was like, no idea what kind of doctor I wanted to be. I'm just happy to be in medical school, right? Like all this new stuff. And then right off the bat, I knew I wanted to do surgery because like the anatomy lab was like this, I don't know, magical place for me. I really just love dissecting. So I'm like, okay, it's surgery for sure. Now, what kind of surgery? I don't know. So I went through, all my stuff and all my rotations, and I did really well in general surgery. And I just worked hard and I busted my butt and I scored like top of my class. And it really just put me in a position to kind of do whatever residency I wanted to do. And so from that point, I decided, you know what? I don't like ENT. I don't like the, I don't know. I started kind of narrowing. I thought about like cardiothoracic surgery. I thought about ophthalmology. I thought about plastic surgery because, I have an artistic side of me. I've always like painted and drawn and, kind of artsy kind of guy. So that fell into that. But I decided to go general surgery, right? Because I really needed to do general to then leap into plastic surgery or leap into cardiothoracic surgery. And really after like 2 years in general surgery, I'm like, all right, I'm going for plastic surgery. Why? Well, one, I feel like patients, all they want to talk about is their scars at the end, right? No matter what like surgical specialty it is, or, they get abdominal surgery and they're like, I don't know my surgeon and I'm not sure what they did, but look at this scar. Right. So I felt like that's what they talked about a lot. Right. And so I don't know, like plastic surgery, we're working on what you can see. And so that kind of resonated with me and just like reshaping things, changing things, moving tissue around, making it look better, making people feel better about the way they look. I don't know, it just resonated with me. I like people. I like talking to them and kind of getting to know them and not just the surgical side of things, which I enjoy the technical component, but I like interacting with people and just hearing their stories and like kind of going along the journey with them. And so, did I know that was like the reason for plastic surgery fitting so well for me at the time? No, but like looking back, that is one of the aspects of why I went that route.
And then did you do a fellowship?
No, so I did general surgery, and then I went into when fellowship's like the funny word because in plastic surgery it's still called residency, right? Like technically it's a residency, but people also call it fellowship, and then you can go on from plastic surgery into another training, which then people call fellowships, where they're like doing a year of cosmetic somewhere. But I went to Wayne State University for plastic surgery fellowship residency. That was 2 years. I interviewed at a bunch of places. Like I did really well in general surgery. I got a ton of plastic surgery interviews. I I had UCSD number one, Vanderbilt number two, and Wayne State number three. And I got into Wayne State, which worked out great because my in-laws live in Michigan and we had two kids. And you need a lot of help, right? It takes a village. So we wound up living with my in-laws. We had a nice house, and it made the whole situation like just a lot easier for us because we had a lot of family help, as opposed to going somewhere like with no family and then two kids and like and my wife's a doctor, and so we needed all kinds of help. But so I did 2 years of plastic surgery residency in Wayne State. The beauty of that program, and this kind of leads into like why I chose the route I did after all this, is that program offered a really wide range of procedures. It wasn't just like free flaps over and over and over. It was a lot of cosmetic, a lot of reconstructive, a lot of little bit of everything. So when I came out of there, I said, all right, do I need to go do another training? Right, I'm already 7 years into training. Or should I just bite the bullet and go and hang my shingle and try to figure this out just because I got exposure to it. And so I decided to do that. And I felt pretty good about it. So from Michigan, I went back to Florida and set up private practice in Fort Lauderdale. So I found a surgeon who was looking to share space. He's an old timer. I'm catching up with that term now at the time, but he was in a practice by himself, had room for another surgeon to just rent space. And so I rented space. I got on staff at like 3 different hospitals in the area and took call all the time and just went out and beat the streets and tried to get patients to come in. And I got patients out of the ER. I got, then taking good care of patients in the hospital, getting consults from other surgeons, and then started getting referrals and started building my practice like that.
So was that a lot of recon?
So a lot of recon, a lot of like flaps and covering knees and wounds and chests and things like that. Some cosmetic stuff started to come in slowly. And one, this is kind of, I think, an important part, and I didn't know that it would turn out to be so big for me. My practice was right next to a neighborhood that was heavily populated with gay men, right? And that at the time, the HIV medication was the protease inhibitors. And the side effect of that was lipodystrophy, a lot of facial wasting, right? So that's where the sculpture kind of came into play, right? And lipodystrophy. And one of the issues with it is the buffalo hump. So the fat pad over the upper back, lower neck was happening with this medication. And it was like a telltale sign that they're on HIV medication, right? Can't hide this area. So I had 2 guys kind of back to back, separate from each other, come in with buffalo hump. And not like the buffalo hump associated with, Cushing's disease or all this medical stuff, that was on our tests. No, it wasn't that. It was the medication associated with it. And so I then said, you know what, I can do this. I mean, this is liposuction. I can, take care of this. And I did it for like pennies, right? I mean, at like I think Medicare or Medicaid covered it, right? But it was like, I think I got like $200 for it or something like that. But it didn't matter. Like I wasn't doing it for the money. I'm here because I love what I'm doing, and I want to like do cases. I want to build my practice. And so I did those procedures and got some before and afters, put them online, and described it as buffalo hump. And I tell you now, flash forward, and I don't know if you kind of looked into this with me, but I have patients come from all over the world for buffalo hump now. Like getting online and talking about it, turns out nobody was doing it. Or if anybody was, it was like minimal. And so that, because I got a nice footprint in it super early on the internet, like if you search buffalo hump, like I come up. And from that, like it just kept coming. People came in. I got one. So now, I mean, I've done thousands at this point. I even did somebody from Mongolia. Somebody came from Mongolia recently. I'm like, Mongolia.
All right,
So
that's interesting.
So anyway, that was private practice. Um,
Well, when you joined that practice, and were you just sharing space, or was there any intent for you to take over the old timers practice?
just sharing space. So that was just go in, pay rent. I used some staff and some of supplies and things like that because just didn't know what to do. Um, but that was that was tough, right? Because when you do that, and if you're not like putting out a massive advertising campaign or like putting your face out there other than just like taking call, that I found very difficult to ramp up a practice. Um, I know some people that came out in practice and did that, but then they put like enormous amount of money into advertising. Right, that's a one way to do it, and that did it for them. That propelled them. But I didn't do that, and so it was pretty quiet for a long time.
How long did you do it?
So I was doing that for about 2 years, right? It was enough for me. Like, so the first year I didn't have enough cases to qualify for oral boards, right? And so the second year I had enough cases to qualify for oral boards. And but then it was still on the slower side and not like great cases, a lot of reconstructive stuff and out of the ER and insurance based things, which is challenging. And so at that point, then I started, and I was also cultivating some local anesthesia skills. So I was starting to do a lot of stuff in the office under IV sedation, very light, and under just local anesthesia. And that was in that the the surgeon that I was sharing space with was doing facelifts under local anesthesia.
Wow.
So on my off time, which I had a decent amount because I wasn't ramped up yet, I would hang out in the OR with him and just see some techniques. And so I kind of picked up on that and it resonated with me because I'm a very patient kind of guy. I like talking to patients. I like to avoid a lot of variables and like the general anesthesia and all that stuff is kind of risky. And I'm risk averse in that sense. So like to keep the patients in like the safest scenario so we don't get into trouble. Anyway, I then started looking around. I don't remember if I looked around or if someone came to me and asked if I wanted to join Lifestyle Lift. Do you remember Lifestyle Lift?
Of course, yeah.
Yeah. So I went and looked at it. I decided to start working with them a couple days a week. And then next thing I'm doing like three, four, and most I did is 5 facelifts in a day. And it's all under local anesthesia. Really, that was not a specific surgery. It was whatever you could do under local anesthesia, really, is what it came down to. How good were you under local anesthesia? And so I got a ton of experience right all of a sudden with doing face and neck lifts over and over. And that really ramped me up. That gave me the exposure to patients. I took care of them like they're my own, not somebody else's practice, in the sense that like I didn't just go in and do the work and then like abandon them, and let the practice take care of it. I was very involved in the patient care afterwards, as it being my own patients. And that started feeding me, right? That number one, getting work, getting some, get a paycheck. I'm also getting these patients that are like, oh, we really like you. Like, what else do you do? Right. And then also now they're coming
That
to,
was really good about they just wanted the facelift and they would give you the rest. So
yeah,
they were a good pipeline to patients for you, you know?
they were a great pipeline.
Mhm.
So, and like for young plastic surgeons coming out, like, I think it's a good idea to join the practice.
I
Like,
agree. Yeah.
I think, that's the way you can get busy right off the bat. You can learn. There's a lot to learn from the beginning. I mean, and the learning never stops, right? I mean, I'm always learning. I'm always perfecting my technique and changing it. But there's a real, baseline that you got to really kind of get comfortable with. And so, yeah, I highly recommend it. Um, so I was working with them, and then one of the surgeons working for them was also working with another company that was liposuction under local anesthesia, right? And so I was already doing that in my office to some extent, and I had time, right? And so then I started working part time in both, and so I started getting a lot of liposuction experience, which turns out I love doing. Right? That's like definitely the majority of my practice now. I do my practice is all pretty much under local anesthesia now, but a lot of it is liposuction fat transfer. So I started working with them and doing good work, trying to get the best outcomes, take care of patients, really just get to know so many, as many patients as possible, right?
Mhm.
And so that was 3 years. So that was probably in my second year. I was now working for two practices and doing my own private practice. And my wife and I started talking about, my wife wasn't involved in my practice at this point, but we had been talking about California, right? I'm like, hey, we want to be out in California. She wants to be out in California. Her parents are moving to California. And so we started looking into it. And the liposuction practice I was working for, which is just because you probably know, it's called AirSculpt now. Have you heard of that one?
Of course. Yeah.
Yeah. So at
The
that point, it was,
my only challenge with that is, as a consultant, I would say, but you're not growing your own practice. You're
yeah,
diluted because, but you need the cases, you need the experience, but
you
then
need the experience. Yeah. And
you
I,
need to
I
build
think,
your
yeah, it's a delicate balance, right? Like, but a patient's a patient. I think no matter where you're doing the surgery or where you're meeting them, it's still a relationship between you and the patient, the doctor and the patient. They really care about that, I think, the most. They're not like, oh, it's my relationship with the air sculpt or my relationship with Lifestyle Lift. It's my relationship with Dr. Yovino, right? Like, and especially if you put in all the care and you're there for them and you treat them not like a number or they're on somebody else's practice, right? They're like your patient. It doesn't matter if they're in your private practice or in somebody else's practice, you're there for them. And that's the way I always approached it.
own.
And I think it's sometimes hard for other surgeons to do like that. Like I know these people, I know these guys, right? They're like, oh yeah, they do it over here, but that's not my. I don't think you can't act like that. Right? Like it doesn't pay off in the end. It's much better if you take care of the patients no matter where they are. Anyway, so I then uh, transferred to Beverly Hills. So I took I was working for AirSculpt, Elite Body Sculptor at the time. That was the name of it. And so they had an office, the main office, really the only office. They had one little offshoot in Fort Lauderdale, which is where I picked them up, but that closed down because that relationship wasn't working. And there was just one office in Beverly Hills with one doctor. And so I came there and started working right off the bat. Boom, I showed up in town and, I got surgery going right off the bat. And then I also picked up Lifestyle Lift, but it was about an hour away. There was no room in Beverly Hills because there's too many docs working there. So I had to drive an hour to go do facelifts and then come back home and then we do lipo. And so, just busting my butt.
The smartest practices know a big part of their practice growth comes from retention, referrals, and repeat treatments, not just from new internet stranger leads. That's why I created the KISS Loyalty Club, a done-for-you system that keeps your patients returning, referring, reviewing, sharing you on social media, and completing surgery. Discover how KISS can grow your own practice revenues by visiting kissloyalty.com today.
You weren't hesitant about entering one of the most uber competitive industries in the world in Beverly Hills?
Yeah. The way I looked at it, one, I just maybe I was just naive, but I was like, Beverly Hills is where everybody thinks about plastic surgery, so everybody comes here, right? There's like a huge, patient population here.
For
People come
sure.
from all over the world, right? Like, yes, there's a lot of competition, but I figure if I show up and do good work anywhere, right, it's gonna work out, and it did. It was the best move for sure.
So your relationship was still with AirSculpt, right? So it was their office and you were just working there and then you were still
So I was working part time. So I was there 3 to 4 times a week, working a lot of Saturdays, basically doing 6 days a week. I was also working with Lifestyle Lift for the first year, and then unfortunately, like they were cutting their percentage, like basically getting pennies for a facelift. Like I mean, honestly, we were getting like I think it got down to about $700 or $750 that I would get reimbursed for a facelift, and I'm like, this is not worth it for me anymore. Like it's like kind of like charity work, and and at that same time, I was starting my private practice. So I was working there, I was working here, and I had a private practice where I had sharing space, right? And that was starting to pick up. And so once the percentage dropped so low out of Lifestyle Lift, and they went out of business not too long after like I left. They got over the overhead, and it was just all upside down. Um, then I left them, and I stayed with the AirSculpt, and I then had more time for my private practice. And so then I was doing that for a while, and I actually did that for a long time. I did that for 4 years, 5 years, something like that, and built up my private practice and stayed very busy there, and actually trained their doctors and was very involved in that company. And as they opened up other locations, the doctors would come and meet with me, and I would train them on how to do the local anesthesia and all that stuff. And eventually, it got to a point where it's funny. Like I think you kind of brought up something earlier. We were talking about how to make the leap to go totally private practice and not work for anybody and be totally on my own. That I'm not sure I would have done that if it hadn't been for my wife, because she then was involved in the private practice, running the practice, and doing anesthesia. She's an anesthesiologist, so she was doing some anesthesia for my general cases, and just heavily involved in the practice because we were basically partners, right? And she got to a point where she was like, "Listen, you can do this. You can be on your own. You got enough patients. You got enough people calling. You're doing enough stuff here. Like we need you more." And I was like, "Oh well, but no, they're feeding me, and it is a big part of our, like, if we look at our income like that, like I'm concerned if I give that up, then we're going to be hurting." She's like, "No, you can do it," and I did it, and it was the greatest move ever, right? But
Don't regret it. Do you regret not doing it sooner, or you're good with what happened?
no, I'm good with what happened. Yeah, could I done it sooner? Sure, but shoulda, woulda. I can't go back, and it was great. I think the timing was right, and I was open for the conversation. Yeah, so the timing was good, and I had gotten a lot of experience at that point, so way more confident, and so the timing was great.
The irony is your wife's an anesthesiologist and you do all awake procedures.
Yeah,
Funny.
right. Yeah, so we've
Still in the
carved
practice now?
we've carved her out, from that standpoint. Um, yeah, yeah, people say that all the time, and it's funny. I got a lot of good friends that are anesthesiologists, and they're always kind of like they scoff at me a little bit when they're like, "Oh, and you're local, yeah, right." Um, but it's a whole art in itself, and I love doing that. Now, so now I'm in solo private practice. Her and I, she is the boss, but she does all the non-surgical side. So
Oh,
when it comes to like injectors and nurse injectors and all that stuff, I don't have that. It's not part of my practice. And the reason is because my wife and I are in practice, and my wife does all the non-surgical side, and I do all the surgical side. And it's evolved into that. It wasn't right off the bat. Initially, I did everything, all the injectables, all the surgeries, everything I could get my hands on, right? And then as I got busier and really didn't have time for the non-surgical side, or at least like those patients were sometimes waiting for hours, right? I'm like finishing surgery, and now I got to come and do the injector. We're like trying to squeeze them in. She started taking that over, and she was already doing it a little bit on her side, just anesthesia. She's also interventional pain management. So she's been doing injections and in really sweet spots of the spine and trigeminal nerves and Botox for headaches and all those things. It really fell in line with her. So she took a hold of the non-surgical lasers, skincare, all the injectables. So
who trained her? Did you train her to
So I
do?
trained her, yeah. So I trained her. She had obviously her own training from an interventional pain standpoint and injecting and getting comfortable with layers and being in danger zone, so to speak. But from a cosmetic standpoint, I trained her. We spent a lot of time, together. Me injecting patients, her there. Uh, I mean, she's also done a lot of just kind of reading and research and on her own development once it kind of gave her the baseline. But she's pretty savvy and has really run with it quite well. So now, I mean, the only time I do Botox is on her, but otherwise she does it on all the other patients. And so it's really nice because the patients kind of go back and forth. They may come in for a surgical consult, and I do some surgery on them, and then they wind up then seeing her because we then incentivize them. We give them discounts. Hey, you're a surgery patient, you get 20% off injectables, all those stuff, and this, they wind up seeing her, and so they're kind of then they're sometimes they're with her for a while, could be even years. Like I have a patient on this Friday, who I did her like I think I did a lipo 360 about 4 years ago or so, and then now she's been going to my wife for the last 4 years for lasers and skincares and the peels and the Botox and the fillers, and now she's ready to do some more lipo, which we're going to be working on the bra rolls and doing some fat transfer to the breast, and so now she's coming back to me. It's kind of like it's nice. It's all in one.
Any tips on working with your wife in a practice?
Yeah, right. So when I was training, I remember like one of the suggestions was not to have your family members in the office, right? And I totally violated that rule. Uh, our relationship, I don't know, I think it's unique. First off, we met in medical school. So I've been with her since medical school. We trained in the same hospital. When I was general surgery, she was anesthesia. Um, but we've always been together, and we like each other a lot. We get along actually quite well. I'm pretty easygoing, same with her, and we don't fight. Like we listen to each other. I always joke like we've been married now for 23 years. We got married right at the end of medical school, and we always joke like how do you make it work, right? And I say, well, we do the dishes together, like we clean the house together. We do like simple stuff, and I think that helps. It's not like you do this and I do this and then we'll hang out sometime, right? Like how about we tackle this life together and do all these things? And sometimes we don't want to do it, but either does the other person. And if you do it together, it makes it a lot easier. And then so I don't know. So I'm able to do that. At this point now, we carpool, right? So we go in together. I mean, sometimes we drive separate cars, but just if our schedule's a little different. But
I'm glad to know this because on your website, you have one of those cool websites where it has the video going on the homepage. And on one of the videos, you're holding hands with a person in scrubs, like you're wearing scrubs and you're going downstairs. And I
yeah,
thought, is he dating the staff? Like, that was my first thought. That's your wife.
that's funny. Yeah, yeah. I know that video. Yeah. Yeah. I'm married to the staff, right?
That's really funny. So when it's all said and done, what would you say was one of the biggest mistakes you made going to private practice that others could learn from?
I mean, I think I mean I would have joined a practice early on, right? Like right off the yeah, like from the beginning, like coming out of training, I would have looked for some practices to join and get going. Because for me, that took some years. It took a couple years to kind of figure out, hey, I should be doing that. And I
Mm.
could have done that like right off the bat and moved a little quicker. I mean, is it a bad thing that I suffer from it? Not really, like, but I also had my wife who was working as an anesthesiologist and was, bringing home her bacon, which was making all of that fine because I wasn't making anything at the beginning. But I'd say that was, I would do that differently. I would have looked into joining practices, joining somebody right off the bat.
Although we talk about that a lot here, that's no, dream either. There are a lot of pitfalls in joining someone else's practice. So I don't know if there's any real answer. I think it's how you handle it once you get there, and then how do you handle it once you're ready to go? Do you have a plan B? You know?
Yeah, it is difficult. I mean, like, because now I'm kind of on the other side where, uh, so now I've been in practice for a while, and I'm like, well, how about I bring in somebody, right? And I interviewed a number of guys, and nobody really bit, like, oh yeah, but then they want to not, and they open their, they did their own thing, and eventually, one of the surgeons said yes, and we brought him in, and he's a good guy. We're really good friends still, but it was difficult. It's difficult because he wasn't doing the things exactly how I do it. The care was a little different. The attention then gets kind of pulled away from our practice into their practice, and there's this whole like stealing patients, right? You're not, it was stealing patients, but like that's what it kinds of getting pulled away. And for me, that was very difficult to kind of let go, right? I mean, I could have let it go and still poured into it, and probably be making more money. But it just didn't sit well with my personality and my care of the patients and how I wanted to run things, And so I feel like me personally is I'm good with just me and my wife, right? Like at least for now, right? Maybe I get to a point where I can reassess it again. But I get it. It's tough. Getting into somebody else's world, right? It's a relationship, you know.
Well, it's almost as important as the relationship you have with your wife. If you could find that that's your second most important, your partner, and it's not easy. And most of the time it doesn't work out. But when it does, it's wonderful because it takes a lot of the pressure off of you. You can now go on vacation. You can take Fridays off. But you're still young.
Yeah, I know. Because now I'm like, when you take a vacation, when I'm off, there's no money being generated, right? It's a zero, right? And so, um, yeah, but you find balance, right? And so I do take some days off, and it is what it is, right? You have to have your own time, and maybe not too much of it, but uh, it helps to have my wife run it too, and say, hey, you could, this is good, this is, you should really do this one, like, so you need to have somebody who's helping, coach you a little bit and on these moves.
Well, work-life balance. So let's go on to marketing because you really, I mean, to go into Beverly Hills, you have to have some guts to do that. And then I usually ask, well, how do you differentiate yourself? And I came up with three ways, just doing some research on you. Of course, the awake procedures. We have to talk more about that and how the patients perceive that. Breast lift without implants and advanced lipo with small cannulas. Where are you getting this from? And did you do this on purpose? Did you realize you were going to enter this hugely competitive arena, so you needed to do some kind of nuance differentiating? Or what was your thought process there?
No, I didn't go in like that at all. I went in. I started doing. There's so many answers and ways of why I've done different things. It, you know, started doing surgeries that I really like. Right. I think that's important as a surgeon is that you got to do stuff that you like and don't do the things that you don't like. Right. And there's a lot of surgeons like liposuction. It's not necessarily liked by a lot of surgeons. I know them, right? They're like, oh, I don't really like doing lipo, but they do it because it's a huge business. It's one of the top, surgeries. But I don't think that's good. It doesn't, you don't do good work like that. It's hard to do good work if you don't like it, right? And so for me, I've started focusing on surgeries that I like, surgeries that I got good results, um, and and so that just kind of kept feeding it. And so, and also the awake arena, the local anesthesia was developing at the same time for me. And so with that, it's a whole different topic, and where I've pushed it into a different arena. And so I do a lot of stuff under local anesthesia that nobody does, right? Like the breasts. So let's talk about breasts for a minute. Um, you know, with breast, I initially like breast reductions, breast lifts, especially the breast reductions. The way I was trained with the whole inferior pedicle technique, the results were not great. Right? But they're like, okay, they're kind of boxy. I'm like, I didn't really like them. I didn't like how the tissue was violated. I almost gave up on that procedure. And then I was like, I don't want to give up on it because like it's a pretty popular procedure. You don't want to give up some things that are like, paying the bills, right? And so I kept kind of researching on it a little bit and playing with some techniques, and then finally figured out superior pedicle technique and understanding some of the vectors and really just paying attention to results and patients and looking and then eventually figured it out. And then was doing lots of stuff under local with the liposuction, and those patients were happy, and they're like, hey, can you do my breast too under local anesthesia? And I'm like, well, I haven't done that, let's do just circumareolar, right? And so I did like 1 to 2 of those. It was super easy. The patients were like crazy comfortable. I mean, like no reason to put them to sleep. And I'm like, okay, well, let me add the vertical component. That was easy. All right, well, let me now just do the Weiss pattern because like I can numb them and they're actually having a good time here. If you numb really slow and in the perfect planes, then it's not even an issue. They don't need to be asleep. So then I said, okay, let me start working on some of the deeper tissue and reductions. And I did small reductions at first by, numbing some of the deeper tissue in the planes that I imagined. And that went great. Now, flash forward to there's no restrictions. I've had some massive breasts, right? Like huge breasts that any other surgeon would be like, no way you're doing that under local anesthesia. And it's absolutely possible. And I think surgeons will say, oh, you can't do that. And they tell patients that all the time. You can't do that, and they just don't know. They just haven't perfected that technique. The numbing technique is an art of its own. You have to have a full understanding of every step of the way of the procedure and what layers you're going to be working in. And you have to numb in all those planes. So I essentially numb in the pattern that I'm going to do the whole surgery. Right. So I like kind of numb in that whole surgery, and then I go back and I do the surgery, you know? So, but I don't do rhinoplasties, right? That's a huge procedure, especially in Beverly Hills, right? Everybody's running around with a splint. That's a big practice in plastic surgery. And, essentially I gave that up, right? That's a huge revenue. But I never really felt totally comfortable with it. I just I had experience, didn't have a ton of experience. I didn't really like the fact that with rhinoplasty, I could do everything right. The cartilage and the bone and the skin and everything just seemed perfect. And then it didn't heal right. Like then all of a sudden it's like a little off. And like, I felt like I didn't get necessarily, you don't get rewarded for doing a great surgery. I mean, you do, but with that one, even the best rhinoplasty surgeons, if you look at their reviews, it's like, oh, I botched my nose and that, like all these things. And I'm thinking, no, it's just like a really difficult surgery with a lot of unpredictability because there's so many tissue types all jammed in one space, right? But that doesn't come off in
And it takes a ton of advertising that type of patient because it's so competitive down there. Some of these guys are spending an absolute fortune on pay-per-click. And if you don't need to compete that way, just go. I like that you went a different direction. You didn't go where everyone else went. You went the other way. How do you explain awake to a patient? Because I think it sounds scary to be awake. How do you explain it?
Yes. So I don't have to talk people into it. People come to me, believe it or not, there's a huge niche for surgery without general anesthesia.
Generally, yes, but IV I like. Awake feels way bigger.
So when we say awake, it's still relaxed. Now, like let's walk you through a normal kind of awake surgery. So most patients take some medicine by mouth to relax them. And so it's not fully awake, but you don't have an IV. You're still breathing on your own. There's no anesthesia. There's no oxygen. There's nothing like that. We give a little Xanax and we give a little Vicodin. Now, not everybody takes it. Some people will take just the Xanax. Some people will take just the Vicodin. Most patients take the combination of it.
Mhm.
And then I wait like 30 minutes till they feel nice and relaxed, and they get sleepy, but they get up, they walk into the operating room, they lay down on the table, we get them all tucked in. They're still I talk with them, I'm in there with them, and they're interacting with me until they're nice and comfortable, and then sometimes they drift off to sleep, but still easily arousable. Like I could sit there and talk and have full conversations with them, but it's more like relaxed surgery.
If you were talking to them or they were talking to you during this procedure, do they recall it? Or like, where's their memory in all
Half
of
and
it?
half. So half and half. It depends. There's a little bit of a interrogated amnesia, right? They're able to carry on normal conversations, answer questions like normal, but then when I like the next day or I'm talking to them, they're like, "Yeah, I kind of remember. Were we talking about?" Like it's a little foggy. It's almost dream-like state,
Mm.
where you can't remember your dream totally. When you wake up. It's not wide awake. Although I have occasionally patients come in and they're like, I don't want to take anything, just numb me up. I'm good. And I have no problems with that. I've done 360s, fat transfers, I've done breasts, like full breast reductions, patients that don't take any oral medication at all. They just come in, they get relaxed, and I numb them. So the numbing is done really like specifically. It's not just like here, grin and bear it. You're going to eventually be numb, and it's going to hurt while I'm numbing you. I can essentially numb these patients where they barely feel anything, and it's not magic. It's just patience and knowing how to inject. Knowing like if I'm numbing the skin, instead of if you come at it like this and you wheel up the skin, that hurts, right?
Mhm.
If you come at it at 90 degrees and give some deep to the skin and just slowly flood it and then back out and do it, you can almost do it painlessly. I have a lot of patients that are going, wait, have you even started yet? And I'm like, I've already got tons of numbing in place. So the numbing technique is a total art. And I don't think I think most surgeons don't understand that because they weren't trained in that, right? We don't get trained in local anesthesia because how can you work on somebody if they're like, who's this guy? He's never done it before, right? So these patients have to be asleep to, get training experience.
Does it, I know that they would recoup much faster just to get, leave the office.
Mm.
Is it any cheaper? Is the downtime better, easier? Is the scarring any different? Like, what are the selling points?
Yeah. So yeah. Well, let's back up. First off, like I was saying, there's a big demand for it. There's so many patients that don't want to be under anesthesia. It's a massive market, right? And I don't think a lot of people understand that. I understand it because people are knocking on the door, or banging on down the door, like, "Hey, can't you do this?" Like, I did a tummy tuck the other day, my first one, full tummy tuck under local anesthesia in the office, and it went beautiful. I'm not ready to sign up everybody for that. That's a super niche, and it takes a special patient. Um, but there's like people don't want to go under anesthesia, and there's a huge push like for being holistic and like I mean, people are not wanting implants, right? They want to take out their implants. They want to be all this natural remedies, right? So they also don't want general anesthesia, right? That's like part of being super duper healthy, right? They don't want the brain fog, and all that stuff that's kind of talked about now. And so there's just a huge market for that. The experience of the procedure is actually a lot more enjoyable than you think, right? You think, oh my God, I'm going to be awake for this. I'm going to get through this. Oh, I got to like really power through it. It turns out almost all the patients go, that was way easier than I thought. It actually was kind of enjoyable, right? Honestly, like how like when you go get a massage and like you just kind of like someone touching on you, right? Or if your like significant other is kind of like, rubbing your head or, like it's soothing, right? There's something soothing about somebody touching you, especially if it's not painful. And I
Mm.
think that's some of the experience, right? Because I've got them numb, they're not hurting, and I'm touching on them, right? We're doing surgery on them, but it's not painful. And I'm not aggressive. Like I know how to touch a patient. I know like when I'm doing a breast and I'm making incisions and I'm moving, instead of like taking my hands off and like grabbing this and the breast falls, right? Which is normally what happens in surgery, Like I know that I let go of it very easily, and I let the breast just kind of settle down and then grab something because I know the patient feels their breast like fall down, right? Like and uh, so it can be a soothing experience. I think it's really special for the patient for the breast for say. Yesterday we did a breast lift, and we've done like 3 surgeries on her now. I took her breast implants out 3 months ago and then let it heal, and now we did a breast lift. And when they're done, and I've got them all they stand right up, right? There's no extubation, emerging from anesthesia, moving to a stretcher, rolling into recovery room, like waking up and going, hey, surgery's all done, right? Where's my mind? All that stuff. They sit up and they go, this is amazing. Look at this. It's great. It's like, so the experience is like right off the bat. And then they stand up, they put on their garments with my tech. Like there's no like just laying there and trying to like get the garments on them. They participate in all that. Uh, so their recovery, like they're able to start enjoying the results, and they're like with us. I think also like this, I can't say it completely eliminates it, but it's pretty close to the whole DVT risk situation. Like blood clots, I've never had one. Like knock on some wood, but I've done this nearly probably like 4,000 plus times, right? Like awake surgeries, and I haven't had one yet, and I don't imagine having one unless it's just a random, like somebody just happens time and gets one on associated with it. But they keep their own tone. They're not paralyzed. They're not unconscious. They're not laying there with no movement, right? They have full movement. They're able to shift themselves. They're able to say, hey, oh, I've got my arm's getting a little stiff. Can I move it? Sure, no problem. I have them move around. I'll grab their arms a little bit and shake it, kind of just move their extremities. The fact that they're getting right up, right, getting off the operating room table, like their circulation, their muscle movements, all those things I think play into decreasing risks for blood clots big time. And I think that just helps with circulation, it just eliminates risks.
Okay. So let's talk about marketing that. Do you actually, when you're what are you doing now? What's working to get you new patients? And are you talking about that in your marketing messages that it's awake?
So we actually don't do a lot of marketing. We do some with Real Self, right? So I'd say that would be what I pay the most would be to Real Self. And actually, to be honest with you, I'm like always wondering if it's worth it. Like it comes in waves. Like there'll be a batch of inquiries that come through Real Self, and I think still overall it's worth it. And so that's that's kind of the only thing I pay for. I mean, we pay for an EMR, which doesn't market for us. Sort of the only thing it does is it does reach out to patients and communicates quite well. Like once they get plugged into our system, it confirms with them and engages with them. If they come in and then they check out, it automatically starts asking for online reviews and gives them links and makes that easier. And I've found that that is more effective than me saying, hey, do you mind writing me a review? And they go, sure. And then we're like, okay, and we'll send you a text. And we do that, and then poof, and nothing, right? You get no review. Even though they had a great experience, they're just like, I don't have time for it.
Any tips on getting the consents for the photos? Because that can be a
That's that's right. So these are tough, right? So this is I'm not a pushy person. Right?
Mhm.
I don't like to push procedures on patients. I listen to them and see what they want, and then same thing with the photos. So everybody that comes through when they're filling out their paperwork has a photo consent on there automatically. They read through it and then they say yes or no, right? And so and some say yes, and then I look at that and talk to them. Oh, that's great, And so we'll take some extra stuff based on the fact that they're open to it, and some say no, and I leave it at that. And then for surgery wise, I do the surgeries. Then so say they've been a no, I check no on there. I do the surgeries, they come back, they look amazing, right? Like it looks spectacular. And I'm like, oh, this is great. I'd love to be able to show this and share with patients, especially patients that are looking to have this procedure and they're looking for a body type that's like them. And you're like a great example. So I try to appeal to like what's out there, what's really happening, right? Like, yes, I'd love to use it for my marketing, my business, and that ultimately is good. But also like other people are looking out there and they want to see stuff. So it does help them, right? And I think it's important to point that out. It's real.
I would also point out that patient also was looking at photos probably.
Yeah, I point that out too. Like, yeah, I'm like, hey, you were looking at before and afters. Yes, I was. I'm like, well, and sometimes they go, you know what? I'm fine with that as long as you crop me out. Da, 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 and I'm like, okay, how about this? And I'll crop and I'll show, is this okay? And I'll confirm with them, and if they're like, oh, that's great. And then I'm like, okay, perfect. And I'll have them sign a new consent.
I call it crop until comfortable.
Yes, right. And sometimes don't do it right off the bat. So I've learned you learn patience, right? So they come in, they have their before and after visit with me, and they look great. And I'm like, oh, this would be amazing, but I know they're a hard no, right? I know them. I got to know them. They're no across the board, and I'll wait a month or two, and then I'll keep them on my list, and I'll be like, reach back out to them. Hey, God, I'm just reviewing my results with patients. You looked amazing. What do you think about like this? And so I think because now they've gone through some time, right? They've cooled down a little bit, and like it's just not so, and they feel a little more, distant from it. They've gone on with their life. They're enjoying their results. Like, and then I'll find that sometimes they'll say yes, right?
I agree.
But yeah, I don't push them, but I do pay attention to it. But I engage with my patients a lot, right? Like I, every patient of mine has my cell phone number,
Mhm.
and I text them at the end of surgery, sometimes even before, like when I'm doing my pre-op markings, they're getting some medicine to relax themselves, they're hanging out. I text them and say, "This is my cell phone, save it." So that way they know it's me when I'm calling them, and I call them at the end. I call every patient after surgery when I at the night of their surgery. Like when we're done, I'm going to call my patient from today. Sometimes they answer. Sometimes we talk. Other times they'll text me back, but they know I'm there for them. And I encourage every patient to interact with me as much as they feel comfortable. Like, let me know, good, bad, not sure. Like, it's easy for me to answer. I've done this thousands of times, right? And so I don't know, that establishes also this photographic thing, right? Because they'll send me pictures, and if you look on like social media, and you'll see like, oh wow, they just sent them a text message with their after photo, and it looks amazing, right? Like, how do you get those type of things? Well, you got to interact with your patients, right? Somebody needs to be doing it, and it's either an office staff member, which I do have. My consultant has her own cell phone, and she interacts with the patients, but I communicate with them a lot, so they send me stuff. I got something today from patients 6 years ago. I posted it on social media tonight. She looks amazing. She's like, "You changed my life," And but I I have cultivated a open communication, and I think it's
About
super.
social media, how much time are you spending on that?
I mean, too much, right? Yeah. No.
So, you feel
So
like you get a good it's
yeah. So I mean, I could spend more. I don't have a social media person per se. I've always done my own. Yeah, and that takes up a huge amount of time. It's a major time suck, right? We do have an employee that has transitioned only as of last week into a social media role. We're just trying to kind of find a position for her. And that is helping. She's made some videos that I like is a little bit outside of the box, a little younger thinking, that I think is definitely beneficial. But I make, for the most part, on my career, I make all the social media stuff because I manage all the before and afters. I know who said yes and no. Like I just feel like if it gets outside of me, it could, you could all of a sudden post somebody who's not doesn't want it, or I don't know. Like it's a control thing, I guess. So I make everything, and I think it also gives off a very personal feel, right? Like it's me doing it. So I think social media is huge. You got to do it. I think, we use Instagram. I try to post on that regularly. I try to really post before and afters, like as my main things that I post. I feel like that's what people really care about. Like, dancing and singing and all that stuff. Well, that's stupid. And like, in general office things, foo-foo stuff, or advertising pictures of like, products. I mean, like it's good, but it's what, at least from a surgeon standpoint, from a plastic surgery standpoint, patients care about results. The before and afters, that's what I find is the most important. So I crank that out as much as I can. I put as many before and afters out there as
They
possible.
want both. They also want your personality. They want to know who you are. So I would just do a blend of both. And you're doing just fine with
Yeah,
that.
no, I do that too. Yeah, I'm just saying, like, I feel like number one's before and afters, but yeah, you're right. Sounds like my wife. My wife's like, you got to get out there and talk more. People want to see you, and so I do that as well. And I think I've tried to show a lot of surgical videos too, and me talking with patients, and this because this awake arena too, right? People will be like, how's he doing it awake? Like, am I going to be really comfortable? Like, I don't want to general, but God, I don't want to be uncomfortable. And so now you can go and look, and you can see all these patients getting surgery in the wake setting, and nobody is, having a hard time.
That's a perfect way for you to explain this awake stuff. Do it on social media like you're doing. It's very conversational and it puts people's fears to rest because it really doesn't sound good. To be awake for surgery sounds awful to me, but it's working.
Yeah, it works. It
We
works.
got to wrap it up. Let me just ask, give me a crazy patient or staff story you care to share.
Yeah. I think, let me just share one more thing. I say for young surgeons or people coming out, I'd say the important thing to get, took me a while to learn, was the the EPLI, the employment like liability insurance, right? Like to cover you for you running a practice, you have people working for you. There's going to be, there could be potential issues with employees, um, and you want to have good coverage. You want to be able to protect yourself, right? And so I think that's important. Have all your insurances in line, uh, and with employees, like, I hate to say it, but don't be friends with your employees. You can be friendly, right? You get to know them, you're interacting with them, but I think a lot of practices make mistakes and have the relationship outside of the practice, and like everybody's friends, and then it's very difficult to run a business. It's difficult to be like, hey, you're not doing your job, you got to do, like, So I think that's, just want to say that I think that's one thing I've learned with time. Um, I think, crazy stories is again, like, patients stealing from you. We've had that. Products, right? So we have cameras in the office, right? I think it's important. Like, if you notice something's off, like, go review your camera, see what's happening. Get your finger on the pulse. I've had employees, steal as well, and like, nobody's immune to it. So I feel like that's kind of crazy. And you have so much trust in somebody, and you get to know them really well, and then they're like, "Wait, you're doing what?" Um, as for like crazies and crazy patients, honestly, I try to keep them out of the practice. Right? Like, if they're treating my staff weird on the phone before they even come in, like, don't book them an appointment. We don't need it. We don't need the hassle.
Yeah, no, I agree. Tell us something interesting we don't know about you.
Um, Well, I mean, personally, it's well, I don't know if this is that interesting, but I like to run. So what I did is I set a goal of 1 mile a day, and I put it like that. It doesn't sound like much, right? You're like, sure, 1 mile, no big deal, right?
A mile is
But
really long when you're jogging.
jogging, right? So 1 mile a day for a year, right? And so with that, if you don't run every day, then you got to run 2 miles, right, or 3 miles. And so, like, I went to Tokyo in July for 2 weeks, and I was working out, and then right at the end of it, I threw out my back, and it was like the worst ever. And so I came back, and I was like 3 weeks of no running. I'm like, oh my God, this is putting a major dent into my goal of one, So now I'm like, I'm 21 miles behind on my thing. So now I'm trying to catch up on it. So uh, for me, like, I think setting goals is like, is important, because then you get stuff done, right? Otherwise you don't, like, things just keep getting pushed out. So now I'm like, I come home, I like get my run in, and so I'm trying to get to 365 miles at the end of this, and it's working. So far I'm 5 miles off my pace. Uh,
Nice. So you made up for the Tokyo trip?
I've been beating the streets now.
Yeah.
So yeah, so I like that, and I like to play. I play a lot of golf if I can. I play in a men's league, and we play. It's every shot counts, and I just won a tournament on Sunday, so I'm pretty stoked about that. You know, and I stay pretty active. We got a new dog. The dog's 85 pounds now, and so it's my first time having a dog. And
Dog. That's a big dog.
half German Shepherd, half Saint Bernard.
Holy cow.
Yeah, and she's great. And I've never really, I mean, I had a dog as a little kid, but it was my parents divorced and I don't really remember it. And so I went all my life really without having a dog because everything's so busy. Kids,
Oh, you have to get
residency,
a dog.
work, there's never time for it. And then my employee found four dogs in the park in a box
Hmm.
and she took them home. And then, like a couple of days later, I happened to mention it in the office, and I was like, "Okay, I've been thinking about it. Like, let me see." Yeah, so they brought the dog over. And I said, "Well, we'll take her," and she was
Oh,
like this big, and now she's like this big.
what
Yeah,
did you name her?
Coco,
That's so
Coco.
Oh, I think dogs are just the greatest thing ever invented. Oh, just
They're
change.
great. Honestly, I love it. Every morning I get up, she sleeps in a pen on the other side of the house. She's too big. She's like having a third person in the bed. Um, so she's so happy to see me every time. And it's just I don't know, it's the hugs and something's very special about it. And I didn't realize how nice it would be, and I really enjoy it.
Oh, I hear you. And with that, we're going to wrap it up. If people wanted to get a hold of you, your website is idealfaceandbody.com. Your Instagram is Justin Yovino MD. Any other way, any email or number if somebody
Yeah,
wanted
I mean, 310-887-9999. Call the office, and everybody's there and ready to speak with you. And if there's any surgeons that ever want to call and talk about all this stuff, and I can share some all my tricks on how I do some of this awake stuff. I think it's important to share. We got the TikTok, and we got the LinkedIn and all these other ones. They're easy to find if you kind of just go really over to the Instagram.
Okay. That's going to wrap it up for us. Thank you so much. I really appreciate your time, and I'll watch your career as it grows. And good for you for what you're doing. Awake is it's exciting. All right, everyone, that takes care of it for us. If you would please subscribe and give me a review so we can grow our own audience. And then if you've got any questions or comments or feedback for me, please leave them on my website at KatherineMaley.com. Or you can certainly DM me on Instagram at Catherine Maley MBA. Thanks so much, and we'll talk again soon.
The fastest way to success is to model other successful surgeons who have what you want, but you can only see their results, not the path they took to get there. So you continue to jump from one thing to another, hoping to find something that will work for you too. But it rarely does. So try this shortcut instead. It's guaranteed to move you forward. I compiled my intellectual property to grow cosmetic revenues, everything I've gleaned over the years, into one playbook of the most successful practices and what they do to win. Go to cosmeticpracticevault.com and let's grow your cosmetic revenues.